I'm Dr. Ponyani, a colleague to Dr. Musa.
Hi guys, I'm Rumbi Mashaya Mombe. I'm a doctor at Baragwanath Hospital.
Hi, my name is Dr. Fomo. I'm an obstetrician and gynecologist at Hani Baragwanath.
Hi, I'm Dr. Atif from the VITS Obstetrics and Gynecology Department.
And in your experience, how is teenage pregnancy in Hani Baragwanath?
Teenage pregnancy is very common globally around South Africa. More so, we see a lot of it there at Hani. As you can understand, teenage pregnancy is an unplanned pregnancy. With unplanned pregnancy, there comes risks and complications. Most of them being obstetric complications. Kids have complications that can affect their livelihood, even their life.
What I want to highlight is that teenage pregnancy is associated with a lot of pregnancy-related complications that we do not see in the older women population. Things like high blood pressure in pregnancy, fits in pregnancy, and sometimes even diabetes in pregnancy.
It's difficult having a child, even for a grown person. It's difficult to cope, and it can limit what you're able to achieve.
In terms of prevention, how do you suggest that we prevent teenage pregnancy from happening? What advice would you give to the young ones?
The most proven strategy for prevention of pregnancy is contraception.
And what is most effective is what we call a dual method, where you choose the type of contraceptive that you use, be it an injectable contraceptive or the pill, but whatever it is that you choose, you combine that with condoms as well. Because these methods only prevent pregnancy, but combining them with a condom helps to prevent sexually transmitted infections as well.
However, for kids as young as 15, it would be advisable as an African doctor, a brother, a sister, that parents get involved and actually teach their kids to abstain as much as possible so that the kids can focus on their books. And contraception can be planned when they are more informed, wiser, more educated.
The other thing that you need to remember is that condoms aren't contraception. They're good at protecting against HIV and some STIs, but they're not so good at preventing pregnancy. So in addition to using a condom, girls, you need to make sure that you get onto a good contraceptive. You need to go to your local clinic, speak to the sisters there so that they can help you find a contraceptive method that's suitable for you and safe for you. And if at all possible, try and get something long-acting so that you don't have to be going to the clinic every 2 or 3 months. You don't have to get injections, so that you don't have to worry about, no, I forgot to take my pill. Yeah.
The effects of teenage pregnancy is that girl mothers end up having to drop out of school. And what we see mostly is that once one has dropped out of school, it is difficult for people to go back to school. And this results in high unemployment rate amongst the youth. So the problem is not only that the girl drops out and is left with the burden of having to take care of that child alone. Sometimes yes, parents and the boyfriend or partner help out, but it's mostly on the shoulders of the girl. But beyond that, it is that the education level drops and then they become unemployable in the future.
Dr. Ponyane, last words of advice you have for the kids?
Kids, go back to school, study hard, forget about boys. Beyond contraception, it's HIV and AIDS. That's a killer. My advice to you guys, go to school, empower yourselves, plan your pregnancies very well in marriage, you'll go far in life.
And this is a message for all you kids out there. Stay in school. Think about contraception. Don't get pregnant, because that can really set back your life and your career. If you've got any questions about it, go to your nearest clinic, go to your local GP and get info. Don't wait until you're pregnant, then it's too late. And remember kids, stay in school.
You guys are at the beginning of your lives. You have so much opportunity ahead of you and so many things that you can do. The world is really at your feet.
Stay in school, get your matric, get your post-matric qualification, then get married and make babies.
Thank you.
Thank you very much, Dr. Green.
Sure.
Yeah, that's my advice to you. Good luck.
I think you can cut actually before I walk out the door. So.
Okay. Yeah.